On today's show, the latest on dealing with COVID-19 here in Washington State.
Welcome to the AARP Washington State Podcast.
Hello, everyone. I'm Bruce Carlson of the AARP Washington State office in Seattle, and this is the AARP Washington State Podcast, where we talk about health, wealth, and self, and living your best life after age 50. Today, we're talking health. As we return to a somewhat normal way of life, the emergence of the Omicron variants has rekindled concerns for many of us as we prepare for the holiday season. We'll discuss these issues with real experts. Dr. Tao Kwan-Gett is the Chief Science Officer with Washington's Department of Health, and Ingrid Ulrey is the Regional Director for the U.S. Department of Health and Human Services based here in Seattle. Even though COVID has been with us for a long time, questions about vaccines and best practices continue to confuse us. How is this vaccine different than those in the past? Do I really need a booster? Can I mix different vaccine types? And what steps can my family take to stay safe over the holiday season? Today's episode is a recording of a live teletown hall hosted by our AARP Washington State Director, Marguerite. There's a lot to clear up, so let's get into it with COVID-19 and you.
Hello, I am AARP Washington State Director Marguerite, and I want to welcome you at this important discussion about the coronavirus vaccine booster. AARP Washington is a nonprofit, nonpartisan organization with a membership of close to 900,000. We have been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. As we return to a somewhat normal way of life, we have the emergent variants that have rekindled concerns for many Americans as they prepare for this upcoming holiday season. While increasing vaccination rates gives us some comfort, we know that vaccine protection erodes over time, and some 100 million Americans who are eligible for booster shots haven't gotten them. Today, we'll be talking about these issues with experts. Dr. Tao Kwan-Gett, Chief Science Officer with Washington's Department of Health, and Ingrid Ulrey, Regional Director at the U.S. Department of Health and Human Services, Region 10, which includes the states of Washington, Oregon, Idaho, and Alaska. If you've participated in one of our teletown halls, you know this is similar to a radio talk show, and you have the opportunity to ask questions live. For those of you joining us today, if you would like to ask a question about the coronavirus and vaccines, press *3, that's *3 on your telephone to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you are joining us via Facebook live stream, you can type in your question and comments, and we will try our best to have the experts answer it. Now I'd like to welcome our guest. Dr. Tao Kwan-Gett, Chief Science Officer with Washington's Department of Health, and Ms. Ingrid Ulrey, Regional Director with the U.S. Department of Health and Human Services. Let's get started with the discussion. Dr. Kwan-Gett, can you talk about where we are in Washington with new boosters, and why has the booster dose become a priority? And would love to hear about how effective these vaccines are against the current variants that are around.
Thanks, Marguerite. And first, I just want to say thank you to you and AARP for including me in this town hall. And thanks to all your listeners for joining us this morning. My wife and I are proud new AARP members, and I really appreciate organizations like AARP that are helping people get accurate health information. So as far as the bivalent booster, we're very excited about it. It's called bivalent because it has protection against two strains. One is the original strain of SARS-CoV-2, the virus that causes COVID-19, and the other strain is the Omicron variant. And our state has done a good job. More than 175,000 doses of the updated bivalent booster has been gotten to people. But we can and need to do much better. If you go to our data dashboard on our Washington Department of Health website, doh.wa.gov, if you look at people 65 years and older, only 37% of those who are eligible have gotten their updated bivalent booster. And the bivalent booster is a real priority because we're entering a winter where there are a lot of concerns about a possible new wave of COVID-19. And some European countries have seen a rise in cases and hospitalizations, as well as some places in the U.S. And so it's really important that as many people as possible get this bivalent booster because it's really the best chance we have to keep people out of the hospital and save lives. And that's a really good question about effectiveness. We don't yet have data on how effective it is against hospitalizations and death. And the reason for that is, similar to the annual flu shot, if we waited to test it against the circulating strains of the virus, then it wouldn't be available till after the winter season. But we really need to get it to people before the winter season when respiratory viruses are at their most active. There have been laboratory studies done, and they've been showing that that the updated bivalent booster produces antibodies against specific Omicron subvariants. And we're very confident that will be effective, but we'll have to wait a little while before we'll have the data to say just how effective it is.
Thank you for sharing that information with us. Just a quick follow-up. With these mutations that we're seeing, does that mean more boosters are likely? And will we be getting boosters as we do routinely with the flu vaccine?
That's a great question. And I think the honest answer is we don't know. We know that SARS-CoV-2, the virus that causes COVID-19, is constantly mutating, and it's very adept at mutating. And although we wish we had a vaccine that could target the parts of the virus that don't mutate as much, that vaccine is really just in the realm of research now, and we don't know if such a vaccine is possible, let alone when it might be available to us. So the vaccines that we have available work against the spike protein of the virus, which is good because it's that part of the virus that latches onto our cells and infects our cells, but it's also that part of the virus that really mutates a lot. And so it's quite possible that we may need future updated boosters like we do with the flu. But the honest answer is we really just don't know.
Thank you for that answer. I'd like to bring Ingrid Ulrey into this conversation. Ms. Ulrey, you have a unique view of the COVID response over a 4-state area. Given the effectiveness of vaccines protecting against COVID or minimizing its severity, why do you think we haven't seen a faster uptake of booster shots? And what is the message that millions who are eligible for a booster need to hear?
Thank you, Marguerite. Well, first off, I just want to say hello and greetings on behalf of HHS Secretary Javier Becerra, and just want to acknowledge the incredible work that AARP does on behalf of your members, both in the COVID response and so many issues. AARP is near and dear to my heart, related to my previous service as advocacy director for AARP for 8 years, AARP Washington. So to your question, Marguerite, overall, nationally, we're seeing around 20 million people have gotten their updated COVID vaccine, or what Dr. Kwan-Gett referred to as the bivalent vaccine. Half of all those shots have gone to older adults. So that means that 10 million seniors, or nearly 1 in 5 in the country, have already gotten their updated vaccine. So that's incredible progress, and we have more room to grow. And here in Washington State, in Region 10, Washington, like always, is leading the way with 36% of people aged 65 plus having gotten their updated vaccine, their bivalent booster. So we've made good progress. And I just want to thank everybody on this call for your diligence in getting your original series, maybe getting 1 or 2 boosters beyond that, And then so many of you who've gone out and gotten the most recent booster or bivalent vaccine. So we know that a portion of people will just never get vaccinated or don't wish to be vaccinated, a small portion. But the bigger problem is many more people just haven't heard about the new updated vaccine. That's why, this kind of call and getting the word out is so important. And some people are just feeling complacent because COVID is no longer the disruptive force that it once was. Under the leadership of the Biden administration and HHS agencies such as CDC and others, and in partnership with our state departments of health, which you have on this call, we've ensured that everyone across the nation has access to tests, vaccines, and treatments necessary to stay safe. But the important thing to know, as you just heard from Dr. Kwan-Gett, is we expect outbreaks this winter for many reasons, and so COVID has not gone away. It's no longer as disruptive. We still have 300 to 400 people per day nationwide who are dying, and many of whom are older adults who are most vulnerable to hospitalization, as well as people who are immunocompromised or people with multiple chronic health conditions. So it's really important at this juncture to do three things. One is get vaccinated if you haven't already. Older adults should know that it's free. It's available at your local pharmacy or your primary care provider. We can also provide links of the closest place to your home to find the vaccine. And if you have barriers to getting to a vaccination site, there's help. The second is tests. If you are experiencing COVID-like symptoms, get tested right away. Fill your medicine cabinet with rapid tests. Order them for free through Washington State. And if you feel sick and test positive or been worried about testing positive, if you feel sick but you're still not testing positive on a rapid test, request a PCR test from your healthcare provider. The third, and I'll just end there, is treatment. Treatment's so important in reducing hospitalization and death. I recently met with Dr. Hashish Jha, who's the head of the White House COVID response, who shared that the average 80-year-old is less likely to get treated than the average 50-year-old in our country. And that's not right, because we know that it's people in their 80s who are at the highest risk of hospitalization and death. So please, if you test positive with COVID, talk to your healthcare provider right away about treatment options. So that's my message, Marguerite. Thank you.
Thank you for that, Ingrid. Let me do a quick follow-up around the work that the administration has been doing. Recently, the Inflation Reduction Act was passed by Congress, and AARP was one of the lead advocacy organizations to successfully give Medicare the ability to negotiate for lowered prescription drug prices. But there were some other very interesting benefits for seniors resulting from that legislation and very relevant to our discussion today. Can you share about those benefits? I think our listeners who are on Medicare would be really interested.
Absolutely. Thank you, Marguerite. The Inflation Reduction Act, or IRA, which President Biden pushed really hard for and then signed into law in September, will lower healthcare and prescription drug costs. And it's actually just a huge win for people on Medicare. As you mentioned, the ability to negotiate with the pharmaceutical industries to drive down the cost of prescription drugs is something that AARP and many other organizations have been pushing for decades. So it's super exciting that this is finally in place. And the agency that I work for, the U.S. Department of Health and Human Services, is at the center of implementing this legislation. So there's a lot in there. In addition to negotiating prescription drug costs, in the future, by 2025, the out-of-pocket drug costs in Medicare Part D will be capped at $2,000 per year. And most immediately, here's the thing that people on this call will see right away in 2023, and that's two things. One is a copay cap for insulin prescriptions for Medicare beneficiaries will be capped at $35 for a month's supply of insulin. That's huge. Some people are paying hundreds of dollars a month for insulin, people with diabetes who rely on that life-saving medicine. second thing is around coverage for adult vaccines. So starting again next year, January 1, 23, adult vaccines recommended by the Advisory Committee on Immunization Practices will be available to people on Medicare Part D at no cost to them. And I've been talking to people about this, and I know that one example that people are excited about is the shingles vaccine, which many people now pay out of pocket, will come at no cost starting next year. So for all these benefits, including the improvements that are starting right away, Marguerite, I just want to remind your listeners that open enrollment for Medicare is happening now. So the open enrollment period is October 15 through December 7th. This is a critical time to evaluate your health plan and drug plan and pick and make sure that you're making choices that are best for your health and the coverage that you need. There's a lot of support out there to do this. If you're able to do it online at medicare.gov, it's quite straightforward to put in your list of prescriptions you're taking and do a side-by-side comparison. And if you need further assistance, you can dial simply 1-800-MEDICARE 24 hours a day, including weekends. There's also opportunity for personal in-person support through the State Health Insurance Assistance Program. That was a long answer, but in short, Marguerite, as you pointed out, really exciting new improvements to Medicare, including no-cost vaccines, which leads us back to the COVID discussion. Anyway, I hope that was helpful. Thanks.
Thank you. That was great information and great reminder about that this, in fact, Medicare enrollment period is happening right now. So I really, really appreciate that. So one more question before we open up the lines. Dr. Kwan-Gett, as we head into the holiday season, health professionals are warning about a triple threat with rising cases of the flu, RSV, in addition to COVID. So 2 questions here. One is, how do I tell if I have flu, RSV, or COVID? And can I get my flu shot at the same time as the COVID booster?
Thanks, Marguerite. Yeah, those are great questions. And the challenge is that all 3 viruses cause very similar symptoms. There might be some symptoms that could be more common with flu than with other viruses. For instance, high fever and chills might be a little bit more common with the flu. But really, you really can't depend on symptoms to tell whether you have flu, RSV, or COVID-19. So as Ingrid said, if you have symptoms of an upper respiratory infection, it's really important to get tested. And then if you get tested and you test positive, let your healthcare provider know right away, because there are some antiviral medications that can be very effective at keeping you out of the hospital. But you need to take those antiviral medications. You need to start them within 5 days of your first symptoms. So the sooner the better. And as Ingrid said, getting vaccinated is probably one of the most important things you can do. And we don't have a vaccine against RSV, but we do have a vaccine against flu and the new bivalent COVID vaccine, and you can get them now. Yes, you can get them on the same day. And another important thing to know about these vaccines is that it takes your body 10 to 14 days to develop a protective antibody response after being stimulated by these vaccines. So it's not the kind of thing where you want to get it the day before your family gathering. If you want to get protected before the Thanksgiving holidays, now is a perfect time to get vaccinated against flu and to get up to date on your COVID-19 vaccines and the bivalent booster.
Thank you. That's the timing is really important. So it is now time to address your questions about the coronavirus vaccine boosters with Dr. Kwan-Gett and Miss Ingrid Ulrey. Please press *3 at any time on your telephone keypad to be connected with AARP staff to share your question. Before we take questions, we would like to do a poll question. Are you planning on taking the booster vaccine along with the flu shot this fall or winter? Press 1 for yes, press 2 for no, press 3 if undecided. Again, that question was, Are you planning on taking the booster vaccine along with the flu shot this fall or winter? Press 1 for yes, press 2 for no, press 3 if undecided. So let's take our first question. Our first question is with James in Anacortes.
Yeah, I'm 83 years old. I've had 2 boosters and wonder if I am up for another one.
Dr. Kwan-Gett?
Thanks, James. I'm really glad you asked that question because it's a really important one because I think many people are in the same situation as you. And one thing that's important to know about vaccines and boosters is that their effectiveness wanes over time. So the more weeks and months that go by since you last got your booster, the less effective it is at preventing infection, hospitalization, and death. So if you haven't gotten the new updated bivalent booster, then you definitely want to get that. And you're eligible for it as long as it's been 2 months, more than 2 months or more since your last booster. So if you haven't gotten the updated bivalent booster, but you've gotten boosted in the past, but your last dose was in the spring or summer, and more than 2 months ago, then now is definitely a good time to go ahead and get the new updated bivalent booster.
Thank you. We have gotten our poll results. 75% of those who responded to the poll say they are planning on taking the booster vaccine along with the flu shot this fall and winter. Thank you for that. So let's go to the next question. We're going to go to Linda in Squim.
Hi, my name is Linda. I'm 72 years old, and I have had the new booster along with everything else that has been offered. My question is that recently I've heard that the new booster could possibly cause some cardiac issues, and my skepticism of non-medical information that comes out like this, but I still would like to know if there is any truth to that.
Thank you for that question, and I'm glad you asked that because it's really important to know about adverse reactions that can occur to vaccines. And fortunately, the vast majority of the time after getting the updated booster or any COVID-19 vaccine, any side effects you have are going to be mild, feeling fatigued or tired, maybe sometimes a low-grade fever or some aches and pains. But the vast majority of the time, 1 or 2 days later, you're back to normal and feeling a lot better. A very rare complication can occur called myocarditis. Now, myocarditis is inflammation of the heart. And actually, when people get COVID-19, when they get infected with COVID-19, myocarditis can be one of the more serious complications of infection. So when you get vaccinated, there is a very tiny risk that you can get myocarditis. But fortunately, the people who've had myocarditis, the vast majority of them have a much milder version than those who get myocarditis when they're infected with COVID-19. And so the vast majority of people who get myocarditis, they recover fully and don't have any problems with myocarditis after that.
Thank you. We're going to go to Diane in Grand Coulee. Diane, you're live.
Thank you for taking my question. It's related to the reporting of and the tracking of adverse effects of any boosters or shots. And the reason I ask my question is I have a 63-year-old sister-in-law who died last January within a week of receiving her booster. There is some speculation that because she was very healthy, very active, no health problems, that the booster had something to do with what happened to her. She developed a blood clot pulmonary, what do they call that? Anyway, blood clot in the lungs. And she was revived a couple times, but there was so much damage that she passed within 24 hours. So the question is, are people, are doctors, hospitals reporting when these sorts of things happen, when there's potentially a tie to a booster? Or I realize pulmonary embolisms can happen randomly, but it was just quite a coincidence and a fear within our family to avoid the boosters, even though we've all had our initial shots after what happened to her. So if you could address the adverse effects tracking, studies, reporting, I'd appreciate that.
First, I am so sorry for your loss. It sounds like an unexpected illness, and so sad for your family, and so please accept my condolences. As I mentioned, the vast majority of adverse side effects are mild and get better on their own. But yes, there can be very rare, more severe side effects. And the United States has a system called VAERS, the Vaccine Adverse Event Reporting System. And healthcare providers, anybody can report a serious illness or any adverse effect after getting a vaccination of any kind. But it's important to know, as you pointed out, sometimes these horrible events can occur coincidentally after you've gotten a vaccine, and it might not be related to the vaccine at all. Perhaps if you hadn't got the vaccine, the event might have happened anyway. But it's so hard to tell unless you do a really careful, detailed study of the data. And so when people look at the VAERS data, the VAERS data, you can't just take a look and see how many people developed a symptom and then say, oh, okay, that's from the vaccine. There's a lot of review that has to occur, going carefully through the medical records, a lot of statistical analysis to make sure that we're not measuring something that, say, is not related to the vaccine. So sometimes you'll hear statistics about an adverse event after a vaccine that sounds really high, and oftentimes it's because the VAERS data hasn't gone through this careful analysis and statistical analysis. So it's really important to, when you hear about a study of a vaccine adverse event, that you know that it's coming from somebody who's really done a careful review of the cases and has done a careful statistical analysis.
Dr. Kwan-Gett, thank you so much. This is Ingrid Ulrey from HHS, and I just want to add a tiny bit to what you've shared. And Diane, thank you so much for the question, and I am also sorry for your loss. In recent weeks and months and throughout the pandemic, U.S. Surgeon General Dr. Vivek Murthy has issued advisories and information and data from across HHS and CDC underscoring that COVID vaccines are both safe and effective. One thing I think is very important to put this in perspective is to think about the risk of not being vaccinated versus the risk of adverse events. So we have large data sets that indicate and illustrate that the relative risk of hospitalization and death for people who are not vaccinated is exponentially higher than those for who are vaccinated. And as Dr. Kwan-Gett was very eloquently explaining, we also have careful tracking systems to look for adverse events, which have been exponentially, have been significantly small compared to the vast number of people who've received the vaccine. So that's not to underscore the small number of adverse events that have occurred. But I think people need to move forward carefully and assess their own risk of what happens if you're not vaccinated and your risk of hospitalization and death from COVID. So thank you.
Yeah, thanks, Ingrid. Those are really good points. And the final thought I'll add is that I am so confident of the safety and effectiveness of the vaccine and the updated booster that I made sure that my parents, who are in their 80s, both got their updated booster.
So we have a couple of questions about the different vaccines. So I'm going to turn it over to Michael. Michael, you have a question about the Moderna and Pfizer boosters?
Yes. Everything I've had up until now was Moderna vaccines and boosters. I scheduled my third booster as a Moderna. When I got to the pharmacy, they said all they had was Pfizer, but there was no difference. And that's my question. Is Pfizer as effective as Moderna, and can you change vaccines like that?
Yeah, thanks for that question, and that's an important question to ask because I think many people are in your same situation. And the good news is that when it comes to boosters, they don't have to be all the same brand. When you do your primary series, it's a really good idea for those to be the same. But boosters, it's okay for those to be a different brand from your primary series. And so the best brand to get is the brand that you can get today. And so I would say for the bivalent booster, whichever brand you can get, and the soonest is the one you should use.
So we have a follow-up question around the vaccine boosters. This is an online question coming from Heidi. Heidi's asking, is there any information on the J&J vaccine boosters? Are they coming out with an updated booster? And what tests have been done to assure complete safety?
That's a great question. I'm sorry. I have to say I don't know the status of Johnson & Johnson booster.
I would agree. Right now, I think the most important message is mix and match is completely okay, and there is no issue. People who have J&J for their original series can mix and match and have either Moderna or Pfizer for their updated booster.
So we have a question. Robert in Tacoma?
Yes. Well, I was curious. I've had all 5 shots. I live in an assisted living facility, and they provide that for us. My son and his wife and family have had theirs, I believe, all 5. But part of their family has not, as far as I know. But because of Thanksgiving, part of that family would like to get together and celebrate Thanksgiving. Okay, we have a tradition for many, many years of gatherings like on the Saturday after Thanksgiving as a family and getting together. Because I'm 91, my son-in-law is 79 and has had some heart issues lately. And my son was concerned about the possibility of becoming a carrier for myself and my son-in-law, because what's the possibility of carrying something from somebody who has not had the vaccination? I'm not sure if I'm being very clear on this, but.
Yeah, thanks for that question. With the Thanksgiving holidays coming up, it can sometimes be a challenge to negotiate, differences in philosophy, because not everybody, is as informed as you and has gotten their vaccines and boosters as you have. Well, one thing that can be done to reduce the risk a bit, and this is it's important to think about this because, as you suggested, it's possible to be infected with the virus that causes COVID-19 without any symptoms. And so you can't just say, okay, well, if my family, as long as my family member doesn't have a cough or fever, they're not infected. When actually it is possible that a person with no symptoms could be infected with the virus that causes COVID-19 and could transmit it. So, one thing you could do is you could ask those family members to test. And actually, you could ask every family member to test the day they see you, or the day before, because although unvaccinated individuals are more likely to be infected than the vaccinated individuals, even vaccinated people can sometimes be infected without showing any symptoms. So especially when there are people with immune compromise or chronic conditions that make them especially vulnerable to possible hospitalization or worse from COVID-19, it's not at all unreasonable to ask everybody to test and only come together if they test negative. Other things you can do is think about the setting where you're having your function. Outdoor gatherings are safer than indoor gatherings. Of course, with the cold weather and the bad weather, many times we don't have that choice. If you are indoors, a better ventilated space is much safer than a poorly vented space. A space that is less crowded is safer than a space that is crowded. So there are those things that you can do to reduce your risk as well.
Let me ask a follow-up question to both of you, since you both have brought up testing. So where can individuals find COVID tests?
Oh, thanks, Marguerite. So I want to note that stock your medicine cabinet with rapid tests is a great thing to do, especially this time of year. There was a national program to order free tests. That has been closed. Part of the issue here is Congress did not renew funding in the way that was requested for the COVID response, so causing some of that to shut down. Thankfully, state of Washington has a similar program. And Dr. Kwan-Gett, are the rapid tests still available to order online for free through the Washington State Department of Health?
Yes, they are. And the program is called Say Yes COVID Test. And the website is sayyescovidhometest.org. So Say Yes COVID Home Test, all one word, no punctuation. And you can go to that website and enter your zip code to see if tests are available in your area.
I like how that rhymes. Say Yes COVID Test. I want to note people can also purchase COVID tests at neighborhood pharmacies. Insurance coverage is available for purchase of over-the-counter tests at pharmacies. And then sometimes rapid tests will continue to show negative even if you're positive. And it's for some individuals, it's important to double-check, especially if you're having symptoms, by getting a test with your primary care provider known as a PCR.
So I wanted to remind folks that we are here today with Dr. Tao Kwan-Gett, Chief Science Officer with Washington's Department of Health, and Ingrid Ulrey, the Regional Director with the U.S. Department of Health and Human Services. And if you have a question, please press *3, or if you're on Facebook, please drop a question in the comment section, and we will try to get to your question. We're going to go now to Tina in Tacoma. Tina?
Hello, thank you. I just had the booster shot and came down with a cold about 24 hours later, and I'm wondering if that is going to affect the effectiveness of the COVID vaccine.
Thanks for that question. And the short answer is upper respiratory viral infections that you happen to get around the time of COVID vaccination don't affect how your body responds, develops a protective response to it. However, if you have a cold, I think it is important to talk to your doctor, talk to your primary care provider, talk to a healthcare provider about getting tested, because it's hard to know. It's not possible to know whether those cold symptoms could be, the first part of COVID-19 symptoms, or if they're from another virus. But the short answer to your question is, if you get a cold after you've gotten vaccinated, that's okay. Your body will still develop a strong protective response to the vaccine.
We have another question about response to or boosters. Carolyn from Mount Vernon?
Yes, I get the injection, and then I get a sore arm, and then I get a red spot, and then I have an itchy spot for about 3 days. Is that anything to be concerned about?
Yeah, thanks for that question. And that's what we call a localized reaction, meaning that the symptoms are around where you've had the shot. And those localized reactions are very common and nothing to worry about. Your body's still going to develop a strong immune response as a result of getting the vaccine. So first, thank you for getting vaccinated. I think that's such an important step for your health. And for these local reactions, have faith that they'll get better on their own, and don't mean anything as far as how well your body is going to respond to the vaccine. That being said, if symptoms are getting worse, say it's getting more red and more swollen, then definitely talk to your doctor. But usually these localized reactions get better on their own. Sometimes people develop sort of an itchy rash in response to the Band-Aid that gets put on the injection site, and so it's possible that if you have some itchiness, it might not be from the vaccine itself, but maybe from the Band-Aid that you got at the time of the vaccine. But again, if the symptoms are getting worse, getting more red, more swollen, or say you're starting to develop a fever, contact your healthcare provider right away.
So we have time for just a couple more questions. Let's go to Maryland and Pullman. Maryland?
What are the symptoms of COVID?
Hi, Marilyn. Thanks for that question. Yeah, it's really, really important to know, and a difficult question to answer because there are many, many different symptoms, and so it's often not possible to tell just from the symptoms whether you have COVID or not. So certainly anytime you have fever, chills, cough, sore throat, runny nose, all of these can be symptoms of COVID-19. But sometimes COVID-19, especially in folks who are older, can have more subtle symptoms as well. So I always think it's a good idea to touch base with your healthcare provider if you think the symptoms you have might be COVID-19.
Marilyn, this is Ingrid Ulrey from the Department of Health and Human Services. Thanks for that question. I really appreciate the doctor's answer. And I also want to acknowledge it's a confusing time. It's a confusing time of year because at the same time that we are expecting to see some uptick in COVID rates, we're also having flu season and RSV. And flu, RSV, and COVID have a similar set of symptoms, right? So it's a confusing time, and it's very important if you have these symptoms to get your COVID test, check in with your primary care provider. Many people are just under the notion that RSV is something that happens with kids, and it's a pediatric problem, and we are seeing a surge of pediatric cases in our hospitals across the region. But it's also a really dangerous and problematic condition for older adults. So we have between 60,000 and 120,000 older adults in the U.S. are hospitalized every year from RSV, and 6,000 to 10,000 of them die due to RSV. So if you're having COVID or COVID-like symptoms that the doctor just described, be sure not only to test for COVID, but even if you test negative, check in with your primary care provider, because now is the season also of flu and RSV, and we want to make sure everyone stays safe.
So we're going to go to one last question with Jessica in Coopville. Jessica?
Yes, I had a question when the COVID will be over with, sir.
That is a really good question.
Was the question, when will COVID be over?
Yes, ma'am.
Okay, thank you. Go ahead, Dr. Kwan-Gett.
Yeah, that is such a good question, and I wish I had a crystal ball. And I wish I had a crystal ball that could tell us it's going to be over soon. But it's one of those things where, we honestly just don't know when COVID-19 will be over. We're worried that there could be a new wave of infections this winter, and that's why it's so important to get the new updated bivalent booster vaccine. But what will happen after that, we honestly don't know. It's possible that COVID-19 could fade into the background. It's possible that COVID-19 could, like flu, become an annual respiratory virus that comes in the winter months. Or it's also possible that it could continue to cause surges that aren't related to the season. So the honest answer is, we just don't know. So although we can't control that, the thing that we do have control over is how we protect ourselves against infection, and getting the new updated bivalent COVID vaccine booster is one of the best ways to do that, because any subvariants that are likely to cause a surge this winter are probably going to be more closely related to the Omicron variant, and the new bivalent booster has a part that is designed to better protect you against the Omicron variant of the COVID-19 virus. So so wish I had the answer, wish I had a crystal ball, but in the meantime, just make sure that you protect yourself by getting up to date on your COVID-19 vaccine and boosters.
Thank you for all of your questions. We are coming to a close, so I want to make sure that our experts, Ms. Ulrey and Dr. Kwan-Gett, is there anything else that you would like to add or that was not covered? Let me start with Ms. Ulrey.
Thank you, Marguerite. Thank you, AARP. And Jessica from Coopville, thanks for the $1 million question that we'd all love the answer to. I want to emphasize that while COVID is not over, and we don't have certainty to when it will be completely over, what we do know is it is no longer the disruptive force that it used to be. Kids are back to school, people are back to work. But the big thing to keep in mind today is that even as we move forward, the people most at risk are people who are older adults, 65 plus, 80 plus, especially those of you on this call who are that age group, as well as immunocompromised or have multiple chronic conditions. It's so vitally important this winter and as we head into the holidays that you stay safe and apply, you manage your own risk, you make your own decisions. But the best things that you can do this winter is get that updated vaccine that we've been talking about throughout this call. Keep tests at the ready in your medicine cabinet. And if you test positive, get treatment right away. So I really want to thank everyone. I also want to emphasize and remind you it's Medicare open enrollment time. Some great improvements to Medicare this year. And please be sure to pay attention to your current coverage, reevaluate, and stay safe. So I'm so appreciative to AARP. Marguerite, thank you so much.
Great. Dr. Kwan-Gett, any last word?
Well, yes, thanks again to you, Marguerite, and to AARP, and thank you for all the listeners who joined us this morning and who asked the great questions. And I agree with everything Ingrid said. And one of the most important things you can do to protect yourself and to stay healthy this winter is to get up to date on COVID-19 vaccines, including the new bivalent booster, and get a flu vaccine. And they're very safe. I've got vaccinated with bivalent booster and the flu shot. And as I mentioned, I made sure that my mom and dad in their 80s both got the bivalent vaccine and flu vaccine as well. And those vaccines are some of the best chance that we have to stay healthy during this upcoming winter season.
Thank you. Thank you so much. We want to thank Dr. Kwan-Gett, Miss Ingrid Ulrey, for providing the recommendations on how to stay safe this fall and winter. I've gotten my booster shots as well and have encouraged my parents as well. This has been such an informative discussion. Thanks to each of you for answering the questions, and thank you to all of our members for submitting questions. Thank you to AARP members, volunteers, and listeners for participating in this discussion. All of the resources referenced can be found at aarp.org/coronavirus or at the Washington Department of Health website, doh.wa.gov. Please make sure that you check out the websites if your question was not addressed, and you'll find the latest updates as well as information created specifically for older adults and family caregivers. We hope that you've learned something today. I certainly have. That information will help us all keep ourselves and our loved ones healthy. Thank you, and have a great afternoon. Take care, everyone.
Well, there you have it. You can find out more on our website at arp.org/WA. And you'll find links to everything we're doing in Washington State, including our upcoming events. We have links to all our episodes on our podcast webpage at arp.org/WA podcast. That's WA podcast, all one word. Or you can just search for the AARP Washington State podcast on any podcast app. If you'd like to contact us, you can email us at arpwapodcast@gmail.com. We'd love to hear from you. Thank you for joining us today. We know there are a lot of podcasts out there. We appreciate you listening to ours. Subscribe to our podcast wherever you listen to podcasts, and if you enjoyed this content, please tell someone else about it. We're trying to spread the word and reach as many people as we can. As always, thanks for listening. Stay safe, stay healthy, and we'll see you next time.